You are listening to the Horse Radio Network, part of the Equine Network family.
Welcome to this episode of the Business of Practice podcast, where we focus on the business and human sides of equine veterinary medicine. In this episode, we're going to talk with Drs. Alexis Baney and Chrissie Schneider about their experiences with recognizing and recovering from burnout and their recommendations for others that are smoldering or already in flames. I'm your host, Dr. Amy Grice, business consultant and former equine practice owner. The Business of Practice podcast is brought to you in 2024 by CareCredit. Dr. Alexis Baney grew up in central Pennsylvania. She rode hunters and jumpers competitively while growing up and developed a love for the equine world. A personal tragedy with her own horse fueled her passion to become an equine veterinarian. She attended Dubuque University in Pittsburgh, Pennsylvania, where she received her bachelor's degree. She worked as a veterinary assistant at a small animal clinic while completing her undergraduate studies. Dr. Baney received her degree in veterinary medicine in 2014 from Ross University School of Veterinary Medicine, and then completed an internship at Brandon Equine Medical Center in Florida. In 2015, Dr. Baney returned to Pennsylvania to join Allegheny Equine in Murraysville, Pennsylvania, where she practiced for 6 years and developed a special interest in equine performance, lameness diagnosis, and diagnostic imaging. In 2023, Dr. Baney opened her own sports medicine practice, Equine Performance Veterinary Services. Dr. Chrissie Schneider is a senior equine professional services veterinarian at Merck Animal Health since 2020. She earned her DVM from the Ohio State University's College of Veterinary Medicine in 2009 and is board certified in equine practice by the American Board of Veterinary Practitioners. Prior to joining Merck, Dr. Schneider was in clinical equine practice for 11 years, including an equine internship and American Board of Veterinary Practitioners residency at The Ohio State University, and 6 years as an associate at an equine-exclusive ambulatory practice in Central Ohio. She is an AAEP member and in addition serves as a facilitator in the Starting Gate branch of Decade One, and also as a mentor in Mentor Vet. Welcome, Drs. Baney and Schneider.
Hi, thank you. Thank you for having us.
To begin today, I'd like to define burnout for our listeners. Burnout is a work-related syndrome resulting from chronic exposure to job stress. It has been defined as consisting of 3 dimensions. The first is exhaustion, with profound physical, cognitive, and emotional fatigue. The second is cynicism and depersonalization, which is essentially a psychological distancing from your work and from your people. Instead of feeling invested in your work, your patients, your clients, your colleagues, you tend to feel detached, negative, and maybe even callous. Cynicism can be the result of work overload, but it's also likely to occur in the presence of high conflict, unfairness, and even lack of participation in decision-making. Persistent cynicism is a signal you've lost your connection to, your enjoyment of, and your pride in your work. The third dimension is a reduced sense of professional efficacy and personal accomplishment. Burnout can occur in any kind of profession. You both experienced burnout after your careers were quite well established in the equine veterinary field, and I too had a period of burnout during my time in clinical practice. I'm eager to learn more about your experiences and how it changed your paths in the equine veterinary industry. Were you able to recognize that you were experiencing burnout, or did someone who cared about you suggest you were burning out? And what did it feel like? Dr. Baney?
I thought about that a lot actually recently, as I am no longer in burnout. But I think I had a vague sense that I was burning out. I felt tired all the time, had a really hard time getting up and getting moving in the morning, which was not my typical feeling. But I think I didn't realize quite how bad it actually had become. I had transitioned from, an internship where you're just tired all the time and you're working hard because you're trying to learn and you're absorbing all of it, and it's kind of expected. And then, going into private practice, at first you're the young, the baby vet. And so you're like, this is normal. This is what it's supposed to be like. And you're working a lot of hours because you want to meet those clients and make those connections. But it started to become, as a senior veterinarian at the practice, that I was not wanting to go to work in the morning, which was a kind of a big sign. I found myself a little bit more irritable with my family and my friends and even my coworkers, and some of the clients. And I didn't feel that I was performing up to my standards 100%, which was not only in practice, but I would say more so in my personal life. And so actually some of my family, my significant other, had brought it up to me that I just didn't seem happy. It seemed like if I didn't want to go to work in the morning, there was probably a deeper problem there that I maybe was ignoring. And then my mother was a big one because we'd talk, every day. That's been our life. And I could find myself like getting irritable with her and, or avoiding the conversations more than anything, maybe not making those phone calls, which was not my norm. The other thing that I did start to realize was I grew up, I loved horses. I wanted to ride all the time. I wanted to help these horses and these clients. And I'm very big on communication with my clients and giving them the time of day. And I mean, at the end of the day, I didn't even want to see my own horses. And I think that was like a big, big moment for me, realizing that I was so consumed by my job and so overwhelmed by the stresses of some workplace environment issues, my cell phone constantly going off, and everything else that I didn't even want to enjoy the animals that I so dearly love and wanted to help. So I think mine was two-part. I think I realized it a little bit, and I definitely can recognize it now. But I also had some people in my life step in and say, hey, I think something needs to change. Something has to give.
Wow, it sounds like you hit all three. What about you, Dr. Schneider?
I really did not know what was going on. When I was experiencing burnout, it was a few years ago, and it was not discussed as commonly as it is now. I do think that's a huge step in the right direction as far as just awareness in the industry can only help people that are in it to say, well, that kind of sounds like me. But there really wasn't. If there was that when I was experiencing it, I did not hear it. So I really just thought there was something wrong with me. And for me, burnout felt like extreme pressure with no way out. I didn't see how I could change anything that was happening. And I really started experiencing burnout after I had successfully built my practice up to the point where I had to start saying no. And, I couldn't drop off that medication today. I couldn't squeeze in that gastroscope tomorrow. And as I was building my practice, I was able to do those things. And that felt really good to say yes and help all these people when they needed or wanted to be helped. But as I became busier and busier, I just couldn't do that anymore. I still was only one person. And, if I set the boundary and I said no to whatever the request was, then the internal kind of turmoil I would have, the second guessing, maybe I should have done that or should have changed this. And then the overwhelming guilt and also like fear of failure, that I wasn't going to be a successful or good equine practitioner. There was some financial pressure that I put on myself, to continue building my practice when I had hit my limit as far as what I could do, because I had been successful, right? So it was a confusing time, but that, pressure I put on myself after I set a boundary was so uncomfortable that the result was I really avoided saying no whenever possible. And then I really suffered for that. And so, kind of at the peak, I had my dream job. What I wanted when I graduated vet school was what I had. But I was really struggling. And so that dissonance was tough and it was scary. I didn't know what to do about it. And so I ignored it. And I was not honest with myself about the difficulties I was having. And I just gritted my teeth. I put my head down and I pushed through. And I really did that for way too long.
Wow. I hear you. You must have really been suffering. When I had burnout was shortly after my mom died. So it was compounded by grief. But I remember feeling like I had to build this really hard shell around myself. And this is back in 2003. Because without this hard shell, I just would weep. Like I can remember driving between calls, crying in my truck, and then having to pull over and pull myself together so I could go and do my job, which meant that tough shell meant that I was not able to be very empathetic or nice. I was very irritable because I needed that so that I wouldn't weep, right? I'm sure that sounds a little familiar to both of you. Wow. Yeah, it was hard times.
The Business of Practice podcast is brought to you by CareCredit. CareCredit keeps equine veterinarians at the heart of care by providing horse owners with simple, budget-friendly financing options. By helping to bridge the gap between costs and care, CareCredit supports healthy financial relationships between veterinarians and their clients. Clients have a flexible way to pay over time for all types of care, and practices get paid in 2 business days. It's a payment experience everyone can feel good about.
What was necessary for you to recover, and how long did it take, and what did it look like? Dr. Schneider?
Well, because I ignored the issues and my struggle for as long as I did, unfortunately, it got to the point where my day-to-day life became what felt like nearly unmanageable. And unfortunately, only then did I reach out for help. When I was like, okay, this is clearly untenable, which I think, now looking back, it was really unsustainable long before then. But I really didn't reach out for help until it was like 5-alarm fire, So I started seeing a therapist who really helped me take an honest look at what was happening in my life. And helped me become more comfortable with those feelings that I would experience after setting boundaries. Because obviously the boundaries, I say obviously now, but at the time it wasn't so obvious. The setting of the boundaries is not the problem. So I became more comfortable with those feelings that would come up after, I'd set the boundary. Setting the boundary was not the problem, actually. It was really those feelings that would come up after I had set the boundary and trying to maintain that boundary. That was kind of the foundation of the issue. My self-awareness through this therapist and working with her, my self-awareness significantly improved just of how I was feeling. And I started to be able to acknowledge those feelings and have less judgment about them. I wasn't even aware that I had the judgment about how I was feeling, but I definitely did. I thought I shouldn't feel this way. So I tried to make myself not feel that way. And it turns out that doesn't work.
Right.
So instead of thinking about what should be or how I should be feeling, I was able to just acknowledge what actually is or was. And through that process, I was able to give myself some space to decide what worked for me and what didn't. I wasn't even giving myself the opportunity to think about what I liked, what I didn't, what worked, what didn't, through that kind of putting my head down, pushing through. And so working with the therapist, giving myself just an opportunity to pay attention to what I was feeling was key in changing things for me.
And when you think about it, whoever has time to stop and think about how you're feeling, you're too busy driving to the next call, answering the next phone call, returning the client's question call,
Yep.
or whatever, reporting results, whatever it is, the list of things you have to complete takes up all of your available bandwidth. It's just crazy. So how long did it take for you to feel like you were not, your hair wasn't on fire and your head wasn't in a vice? How long did it take?
I mean, probably the hair on fire, head in a vice, that was maybe 6 months, but it also, at the same time, my technician was leaving and I really relied on her a lot. I was going to have another one, but I felt like not only was I on kind of shaky ground anyway, but then she did so much for me that the thought of training someone new and relying on someone else at the same time that this was happening, that was just a hard, variable in it. So I think that did kind of extend it a little bit.
Oh, yeah.
Yeah.
What was it like for you, Dr. Baney?
I can probably reiterate a lot of the things that Dr. Schneider mentioned. I had already actually been doing some counseling because I think I at least had the wherewithal in my brain to realize that somewhere in there, like I wasn't happy and I was feeling stressed and wanted to throw my phone out my car window every day as I drove along, as it kept buzzing. So I was already doing some counseling, which I do think was really helpful for my just mind and soul. I quit my job. I decided one day that I wasn't going to put up with it any longer. And I didn't even ask for, I could have asked, I probably could have asked for time off. I could have asked for more money or whatever, right? But at the end of the day, more money wasn't going to solve the problem. And if the true culture and, everything that was happening as far as the negatives weren't going to change, it wasn't going to make a difference. So I did. I kind of shocked everybody and I told them I was quitting. And then I took 2 months off where I did no vet med. And I think that was huge for me. That was really good for me to just breathe and take some time to reflect on, life. And there were some personal things going on at the same time. And, and what did I really want to do? And I loved vet med and I didn't want to leave it. And I loved equine, but I needed something different for myself. And so I actually went and worked with a friend of mine who owned a small animal clinic. And I did 18 months riding out my non-compete at the small animal clinic, which was very different going from equine back to small animal. And I continued my counseling and, took the time to spend more time with my family and more time for myself. I went and rode my horses. Or I went and just brushed them. And instead of going to see them once a month, I was, making it out at least once a week. And so that was, I think, a really big part of my healing. And it took a long time. I think even after 2 months, I don't know that I felt truly ready to go back into the veterinary world, but it was kind of more of a, I have student loans to pay, I have to have some kind of a job. So it was a little bit of a necessity, but I think really, same as Dr. Schneider, I think really a good 6 to 12 months to really get myself back on track, back in love with veterinary medicine, having that dream of, okay, I'm not ready to leave equine. What do I want to do? And how do I do it? And yeah, so I think it was, a lot of self-healing, reflection. What do I need? And how can I make that happen?
Yeah, that's such an important point that you have to take the time and you have to give yourself the space for that self-reflection. You can't just keep pushing forward because the more you push forward when you're in that state, the more broken you get. It's wow. I'm so glad you were able to take that time for yourself, because otherwise you just burn up and you're crispy. So you both ended up deciding to change your work. How did you decide what that new work situation would be, and how did that evolve? Dr. Baney, I know you went to small animal and then you opened your own practice. How did that all look?
Yeah. So, like I said, I think, I was very blessed to have my friend who owned the small animal practice. And I remember her exact words to me were, even if you just need a safe place to land for a while you figure things out, which was so great because I felt like there was no pressure to make a career in small animal if I didn't like it, or, but it was open. If I did enjoy it, hey, here's a place where I might be able to continue to grow in my career. So I think, I knew that equine was in my heart. I wasn't ready to leave it just yet. But I took that time to, heal and prepare myself. So for me, the small animal was kind of my bridge through those troubled times. And I knew that going forward, as much as I loved group practice and I really love having colleagues to talk to and go over cases with and things like that, I knew that for me personally, after experiencing the burnout, I really needed to be in control of my own life and my own schedule. I think, I was dealing with also on the personal end. I'd had a loss of a grandfather. I had, a family where I'm not in a conventional family. I have, a blended family. So it was also just making sure that was really important to me and making sure that I was able to live that personal life the way that I wanted. And I just knew that that was going to be really difficult to do in a group setting where there was emergency and a hospital and everything else. And I really wanted to focus on sports medicine. I loved sports medicine. I was trying to grow that towards the end of my career. I'm an Allegheny equine, and I just wanted to continue. So for me, I knew I wanted to be my own boss, as scary and as hard as that seemed. I was terrified that I wouldn't be able to do it because I have a lot of student loans from my vet school at Ross. And I thought I'll never make it, but I had great support, which I think is the number one starter out, most important thing. I had support from my family. I had support from some of the veterinarians that I had used to work with. I had the support of you, Amy, which was amazing, because I know we sat and talked about, what does this look like and how can we make it happen? And I think Decade One was a really big stepping stone for me. If I hadn't gone through the Decade One program, I don't know that I would have felt confident enough to go out on my own and start my own practice. But I had seen multiple members from our group do that and be successful. And so that was huge. And then I just knew that going forward with starting my own practice, I needed to set boundaries from day one. And that was a big thing, was making sure that I thought about what I wanted that practice to look like, what I wanted those boundaries to be. And I set them from day one, and I have not let myself, fall away from that, as well as having a team member. So my technician actually from Allegheny Equine had followed me to the small animal clinic and then with me to open this practice. And she has also she went through some of the same cultural stuff that I did. And, she's been instrumental, because if I start to falter on my boundary and let things get crossed, she steps in and is like, no, we're not doing that. And that's been really good, because it's let me, focus truly on what I love to do, but also to be respected and respect myself, which I think is huge, because I know I did not respect myself whenever I was in group practice. And I always gave up my time, and, everything else was more important than my own life. And at the end of the day, that's really not the case. So I think for me, that's kind of how that all fell into place. And it's amazing. Like once things got started, it really just all rolled into, the right steps, forming the practice, getting all my equipment. I was able to do all of it. And I, haven't looked back since. It's been busy and great. And I love being my own boss. And so that's kind of what it looked like for me.
And it's nice, I can hear the smile on your face and how much better things are for you. And you are so right that the person that is most likely to run through your boundaries is you. Yes. So you have to have accountability. Yep. Dr. Schneider, your path was different. Tell us about that.
Yeah. So, I mentioned that, kind of took 6 months probably for the, head in a vice, what do we say? Head in a vice and hair on fire to get better. Giving myself some space to think about what I liked, what I didn't like, et cetera. And ultimately in all of that kind of soul searching and what do I want for my life, I ended up transitioning out of practice and into the animal health industry. So I'm currently a professional services veterinarian for a pharmaceutical company. And when I was deciding what I wanted for my life, for my next professional position, I felt really strongly that I wanted to use my education and my clinical experience. I wanted to stay in the equine veterinary industry. It's what I know. It's what I'm passionate about. I didn't have the bandwidth or really the interest, I guess, to go to a small animal situation like Dr. Baney mentioned worked for her. I think I just felt like that was insurmountable to me. I know that logically, I know I could have learned it. I could have done it, but I just didn't even have the oomph, to do that. And so I was like, how can I use all this experience that I have and help other equine veterinarians and be with them and staff, et cetera. And then I also thought about what I like to do, what my personality is like. How do I like to spend my time? I'm definitely a people person. I really enjoy getting to know people. And I like educating. I like providing hopefully useful information to people who may not have time to seek out that information, whether they're veterinarians or veterinary team members. And really all of those things are wrapped up in the role of equine professional services veterinarian that I have now. So it's a great fit for me. It's a really fun job. I love that I get to help veterinarians on behalf of the company I work for. And I love that part of my job is to stay up on what's happening in medicine. And I really feel like I could go back tomorrow. I've done some relieving here and there over the last few years, and it's like riding a bike, it's all still in there. And I think that was part of my fear in changing something. That was a hurdle to think like I would then lose this opportunity. Like I could never go back to practice. This door would shut. And that's not true. So, if I decided tomorrow, I'd really like to go back to practice, I can, mm-hmm. It's not, one way only. So you're really there's not a ton of risk in trying something new is what I'm saying.
Yeah, whatever decisions people make in their life, they're usually they don't have to be permanent. That's a really big thing. So, as you came out the other side of the burnout and started your new job, and are you living life differently because of what you've learned? Dr. Schneider?
Definitely. The biggest difference in how I live my life now compared to before this experience with burnout is that I make a concerted effort to be honest with myself, which sounds maybe a little funny. Like, how could you lie to yourself? Like, we're all in here together, like in this one brain. But it's amazing what I could ignore and avoid and try and distract myself from. So now, instead of ignoring my intuition, my opinion, or my preference, or try to force them to be different, I just acknowledge them and try to act in accordance with them whenever possible. And that really takes so much pressure out of my life. I think if we don't let our conscious mind make the decisions we need to do what's best for ourselves, then our subconscious mind kind of makes it happen anyway. But in that situation, I think it's likely that it'll be at a less convenient time and maybe in a more dramatic or inconvenient way than if we just let our conscious mind accept what is real, what we think, how we feel, and then make decisions accordingly to help change what we need to change.
Yeah, I would agree. And I think importantly is opening yourself to the idea that you can change, that you are not stuck. That, I mean, one of the things that my mind repeated to me over and over is, you don't have any choice. You have to do this.
Yeah.
And there's always a choice.
Absolutely.
You just have to be able to give yourself the grace and the space to take and make those choices.
Agreed.
Dr. Baney, how has your life changed?
A lot. I can probably echo most of what Dr. Schneider said. I think that's a really good description of being honest with yourself. And it's hard. It's really a hard thing to do. But I think, some of the things I mentioned earlier, I set boundaries for myself and I hold myself to them. And I think that's that second part of that. That's really the toughest part, is like holding yourself accountable and making yourself realize that, oh, I did set that boundary. This is crossing it. That's not going to work for me. I've improved my work-life balance. I've made, a very big focus on family time and making it home for dinner, as much as possible, right? I mean, no life is perfect, but, making it to the sporting events, making sure that I'm trying to not be bound down with paperwork and sitting and doing notes for hours on end every night. So I've looked at, opening my own mind to some of the things that are out there, the tools that are out there now for us as veterinarians, right? And I was kind of closed-minded to a lot of that stuff at first because I'm very much like a change is scary kind of person. But I'm trying like an AI program to help me with my notes, and it's really awkward and weird at first because you're voicing all of your findings as you're doing your exams. But at the end of the day, yes, you still have to read them over, but it's much quicker if it's already kind of typed up for you in summary form. Or, I'm delegating, which I'm learning to do as far as some of my, I can't run this entire business by myself and I need help, and asking for help is still difficult, but I am focusing on it and getting better at that. I think that's a big one. And then I think like two of the other really big ones for me have been, one, if my boundaries are crossed by clients, I fire them. And I never really had the autonomy to do that before in group practice. So not that I'm firing every client, but the option is there, right? Like the option is there if it's a really bad situation and it's just going nowhere and I'm being disrespected, or, it's just one of those cases where they are continually crossing that boundary that I've set. That is an option. And I think that we're very afraid of losing clients, and we're taught to, customer service, and you don't want to lose anybody. But at the end of the day, I haven't lost all my clients because of that, and it's because I'm just not going to put up with those kind of things, anymore.
Right. You don't have to be so scared.
No.
You don't have to come from a place of scarcity. You can come from a place of abundance, and that people who want who you are will continue to come to you and, adhere to your boundaries. Yeah.
Right. And if that doesn't work for them, then we're not supposed to have a relationship, and in this veterinary world. And the other, like the last thing that I would say is, I take vacation and I take time off, and Like this morning, I took my dog to the cardiologist and I didn't work this morning. I worked for a couple hours this afternoon. And at the end of the day, it's okay to take that time off. I don't have to work myself into the ground. And that was really, honestly, like one of the most difficult things for me in the beginning of my own practice was not getting into that cycle of like work, and, work all hours of the day. And even though I wasn't doing emergency, and I had to like step back and say, it is okay to work a 4-day work week and have an administrative day, or it is okay to go to Colorado and visit your family, or, and so I think that is, I've had a lot of changes, but I'm just in general, I'm a happier person. And I feel like I'm back. I was thinking about something Dr. Schneider said earlier in our discussion about when you're in burnout, you don't feel like you're being the best veterinarian that you can be, or that you're not the best version of yourself, right? And you don't really want to pass that on to people. And so for me, like, that's probably the biggest thing is that I feel like I'm happy and I'm back to being that person. I want to be the best veterinarian that I can be. And these changes have allowed that, which is huge.
Yeah. What would you say to someone who, one of our listeners, maybe more than one of our listeners, may be tipping toward burnout? And what advice would you give them at this point, Dr. Baney?
I think my biggest piece of advice would be that you're not alone and someone else has been there, and that there is support out there. I think there's been such great things with like equine vet to vet and non-vet and Decade One and some of the other, groups. And I think that's the biggest thing is open up to somebody, whether it's a family member or a counselor or a friend or another veterinarian, whatever, and just talk about your situation. Don't allow yourself to bottle it up and just keep on chugging through, because at the end of the day, it's not going to get better. It's just going to continue to get worse. And something I've seen a lot actually on like equine vet to vet and some of the other groups is like people who just feel very stuck in their situation. And I know that feeling. I felt that myself. I thought this big group practice that I'm a member of, I even got told at one point, like, go ahead and try to start your own business. You won't succeed. And I think that it's a scare tactic, right? And it's very scary going out on your own. And you think, can I even do this? Can I make this happen? Not only for my work-life balance, but financially. But I think you can. And so educate yourself about your options. Look into some of the groups that are teaching about business management, Decade One, BMG, some of the others that are looking at, helping practices do better and maintain good practice skills, right, with the finances and all that. But also set your boundaries, take a break, even if you need to just walk away for a while. Walk away and take that break and give yourself a little bit of grace. I think that's the biggest thing.
Thanks. How about you, Dr. Schneider? What do you think is the best advice for someone who's just feeling at the end of their rope?
Yeah, I think first, as I've already mentioned, just being honest with yourself about how you feel is, I think, the first step. You can't change anything you're not aware of. So, just being honest about what's happening is the first step to doing anything about it. And then second, don't use someone else's ruler to measure your own needs. So just because other people are doing something and seem outwardly to be content, that really isn't relevant to what works for you. And then also kind of in parentheses, they might not be content because we don't always show, everything that's going on. And so just because other people are doing it, if it's not working for you, then it doesn't work for you. And that's okay. And then certainly, after hearing my story, I think you'd understand why I would recommend reaching out for help sooner than later. it's so fantastic that there are as many resources available as there are today. That has been a huge improvement, I think, just industry-wide over the last 4 or 5 years. So don't hesitate to use them. Dr. Baney already mentioned that the Decade One program, which is fantastic. Another one is AAEP's Member Assistance Program. That is a great benefit that AAEP has for us as members. And so if you just need something to kind of kickstart, like, where do I even go from where I'm at? I think that's a great start. And you can change things in your life. It will be hard, almost for sure. I think that's kind of a guarantee, but it will absolutely be worth it.
That's great. That is such wonderful advice. Is there anything else you'd like to share with our listeners, Dr. Schneider, before we say goodnight or goodbye?
Yeah, I think that there is freedom and hope in the agency that we have in our ability to navigate our lives. So while these choices can seem scary and it can seem, insurmountable sometimes, like what feels like a big hurdle or a big mountain to climb to change things, but it also provides us freedom, and we get one life as far as we know, I guess, depending on what you believe. But we really need to do what we need to do to make that life full of purpose and joy, whatever that looks like for you. So I just really encourage everybody to think about it and do what you need to do.
I love it. One of the things that I sometimes say is, it's your life. You get to choose.
Yeah.
Dr. Baney, anything you'd like to add?
I don't know that I have anything great to add. That was fantastic. And I think just that reiteration of, at the end of the day, we aren't taking that money with us later on in life, right? When we're gone from this life. And so at the end of the day, don't compare yourself to anybody else. Don't worry about the money. Don't, do what makes you happy. And I think that is something that we are very much taught to kind of ignore. And I think that part of the profession is changing a lot. And I'm really excited to see where things are going, and to just lean on your support. That's the biggest thing. That's what really got me through a lot of my burnout. And I'm always open for anyone to contact me and talk about it. I'm happy to talk about how I did things and got through, and I'm sure Dr. Schneider is as well. And, but I just really appreciate you inviting us also, Amy, to do this, because I think this is such an important topic. And I just want people to know that they're not alone and they don't have to hide in that fear of being stuck.
Yeah. People sometimes get in that stuck feeling because they feel like they don't belong if what has always been out there as the visible equine practice isn't working for them, and they're feeling like it's burning them up. They feel like, oh, I don't belong here. It's not true. You're not alone. And many people have experienced things like what you may be experiencing. So thank you so much for joining us today, Drs. Baney and Schneider. What you've offered to the listeners today is really, really valuable. And thank you all who joined us listening to the Business of Practice podcast. And a really big thanks to our sponsor, CareCredit. Without you, we couldn't be doing this. And to all my listeners out there, be brave, embrace change.